Welcome, everybody, to the groundbreaking ceremony for the Swanson Family Chapel. Before we get started, I'd like to make just a couple of quick introductions. First off, most important, I introduce my boss. She's my new boss, so please be nice to her, say nice things about me. Julie Springle is the president of the Southwest Division of Common Spirit Health. And I just want to say, in the short time that Julie and I have had the opportunity to get to work with one another and know one another, she asks a lot of questions. She's very curious. She understands hospitals and patient care. She understands community need. And one of the things that she engaged herself in very quickly was the Beyond Health campaign and the Your New French Hospital project. Early on in her tenure, she came and visited all of her hospitals, and she has quite a few of them that she has responsibility for, and very quickly got the purpose of what this campaign is about. Being a nurse by training, she saw the 3-bed rooms and the remarkable work that's done in this hospital in spite of the physical situation barriers that we find ourselves in. So she clearly understands what the value is and quickly jumped on board to help us promote and keep this project active and alive. And the fact that she took time out of her schedule today to come to what is the beginning of the Beyond Health Your New French Hospital project is incredibly important to me. So please join me in thanking Julie for taking the time to come and be with us. Julie, thank you so much. Quickly, also, our wonderful vice chair of the community board, Anita Robinson. There's Anita. Anita, thank you. Eric Justinson, the chair of our French Hospital Foundation board. Eric, thank you. Dr. Michael Clayton was supposed to be here with us also. Unfortunately, he had an accident at his home and is recuperating from that accident. So he sends his regards. I spoke to his wife this morning. He wished he could be here. He's very supportive of the work that we're all doing here and apologizes that he couldn't be here. But please keep Dr. Clayton in your thoughts and prayers. So this is an historic moment for us. We've come a long way in a fairly short period of time. In 2004, when then CHW purchased French Hospital, we took over a hospital that was in pretty bad shape. It hadn't been maintained, it hadn't been cared for, capital had not been put into the facility in a number of years. And the previous owners took what they could from it and left a rather poor hospital in its place. But when CHW came in, they made a pledge to turn the hospital around, to understand what the community's needs and expectations were, and to build from the ground up. And over the last many years, we've been doing that. To date, we've put well in excess of over $100 million in renovating this facility. We've come a long, long way. But that's only the beginning. Because what we promised early on to the community in meeting their expectations was to introduce a whole different model of care to this community. And that's what Beyond Health is about. And that's what this project is about. It's the beginning of a transition of a care model that will be different and unique in San Luis Obispo County. And we're very, very excited. So this is the first of many projects that we'll be breaking ground for over the next few years. Thank you for joining us. The hospital chapel itself has particular personal meaning for me, and I'd like to tell you why. When I was selected to come here in 2004, I was getting a lot of advice from a lot of people about how to turn the hospital around. The best advice that I was getting was from the wonderful sisters that were associated with Catholic Healthcare West, including the wonderful local sisters here, the Sisters of St. Francis. We talked an awful lot about holistic care and what holistic care means and what it is. Of course, it's about treating the body, the mind, and the spirit. It's the best kind of care. It's the kind of care that Your New French Hospital will be very proud to give. A good part of treating the spirit is to provide a sanctuary, a place where people can take refuge in times of stress, times of fear, in times of need. A place that they could go to think, to meditate, to pray. French Hospital, because of its size and the way it was constructed, never really had a chapel. But we found little closets that we would convert. We have one now, and it literally is a little closet that we call a chapel. I had promised the sisters back in 2004 that if we ever had the opportunity to build a new hospital, that one of the first things that we would do is to build a chapel where all would be welcome. It would be interfaith, it would be universal, where all could come to meditate, to think, to pray, to seek refuge. All would be welcome. That was a promise I made back in 2004. As I get closer to retirement, I was concerned that maybe I wouldn't be able to keep that promise. And that was pretty distressing to me. I had an opportunity to talk to two wonderful friends and wonderful philanthropists and supporters, not only of French Hospital, but of a number of other entities in our beautiful community and beyond, and that is Bill and Cheryl Swanson. And I talked to them about the promise and the commitment that I had made to provide a chapel. Bill and Cheryl took to that story, and they bailed me out. They offered the cash, the dollars, to help make that particular dream and that promise come true. So I want to thank Bill and Cheryl for bailing me out with the sisters. Bill, I think you're right. Because of that, there probably is a place in heaven for you and I. Thank God we need it. I want to thank you for your generosity. And Bill, I'd like to invite you up to make a few remarks, please. Bill Swanson.
Thank you, Alan. I have some prepared remarks, so I stay on script. If you let me loose with the mic, we could be here all day. Alan, I want to thank you for the kind words. It's a pleasure to be here today for the groundbreaking of this new addition to the hospital. My wife, Cheryl, is with me. And let me start by saying we've been supporters of French Hospital for some time, even though our home was in Boston for many years, but our heart was always here. We did buy a home in 2002, but we were not able to spend much time here until I retired. And we decided to move back permanently back at the end of 2019, right before the pandemic. I guess our timing was perfect so that we could be back here. For the record, we've also been supporters of the Massachusetts General Hospital back in Boston, too. We've learned how important a great hospital is to the community. I was fortunate to be the chairman and CEO of the Raytheon Company, which was one of the largest employers in the state. And I can't tell you how many times the hospital came to our aid. The same is true of the French Hospital. It has provided excellent care for friends and families. Our hospitals need the support of the community, and they need individuals to support them. When Alan and John Ronca, and John is a member of the hospital board, approached us, I kind of knew something was up. It's like when your HR manager, general counsel, and VP of communications want to come in your office. You kind of know it might not be a good thing that's going to happen. But Alan and John both went on to explain the latest campaign, Beyond Health, for the hospital. They laid out the things that were needed, and as Alan mentioned, they mentioned one thing that really piqued our interest, and that was the chapel. We all know how great the medical team here is at the hospital. They are miracle workers, in my opinion, but as good as they are, there are times when the outcome is not what we all hope is the case. The chapel provides us, no matter what our faith, the ability to have a place to reflect, gather our thoughts, and for prayer. Alan also explained how the sisters wanted a chapel as part of the hospital, and as he said, he made a promise to do so when it was possible. What Alan really didn't know was that I was a product of St. Francis Sisters in a parochial school, and I may not have been a model student. We won't go into the details, but I thought it provided a nice opportunity to do something for the sisters. So with John's and Alan's help, we drafted an agreement to fund the chapel. But the story doesn't end here. In our first meeting with the architects and construction company, Alan explained how the chapel could be a little bit larger than envisioned, and with the square footage increasing, asked about stained glass windows. He also invited Elizabeth Devereaux, whom you may not know, but she's an internationally recognized stained glass artist, to the meeting. She explained what was possible. We all thought it was a great idea, and however, Alan went on to point out to us that he had to find a donor because the windows weren't in the budget. Cheryl and I quickly decided that these windows would make the chapel an unbelievable part of worship in our community, and we committed on the spot to fund the windows. I should point out that John and Alan were more than happy to amend our agreement at the time. Now, the story doesn't end here. A few weeks later, I get a call from Alan, who tells me he woke up in the middle of the night and he thought the chapel should have a bell tower. He had turned on the architects to design a bell tower for the chapel. You guessed it, he had to find a donor for the bell tower. I then asked him to take something to help him sleep at night and no more changes, and if he promised, we would fund the bell tower. Another change both John and Alan were happy to make in our agreement. Alan then put me in charge of overseeing the project. This way I've been able to make sure no more changes. We worked for some time with Elizabeth, the architects. I see Jackie Stewart here on the interior design, and the windows, which we have learned to call the ribbon of hope. It'll be something that individuals of all faith can enjoy. It will provide a calm, serene environment to be able to gather our thoughts and feelings. All the elements in the design of the chapel have been completed. We're ready to go. I do want to thank John and Alan for their help, as they have allowed Cheryl and I to do something where we can give back to others and our community so that it'll make it better going forward for all. Cheryl and I hope you all will be as proud as we are what is yet to come to the hospital and our community. Thank you all.
Thank you, Bill. Thank you, Cheryl. Great story. Now it's my pleasure to introduce the two co-chairs of our Beyond Health Capital campaign that has raised already $15 million towards a $30 million objective towards what will ultimately be probably about a $150 million project. And so we're about halfway there to our commitment to the organization. And we have two incredible leaders, Dr. Ping Sao and Bob Wacker, both great philanthropists in their own right that agreed to be the co-chairs of the campaign. I'd like to invite them up, please. Bob and Dr. Sao. Take your first, sir.
Good morning. I'd like to expand on today's chapel groundbreaking as the groundbreaking, as you've heard, of your new French hospital. The word groundbreaking itself implies several things: innovation, something unparalleled, and state-of-the-art. And from a medical perspective, Beyond Health is that important breakthrough. I retired from a career in surgery for 38 years here in San Luis Obispo. And during that career, one of the most important things that I came to realize is that the most important surgical instrument is communication. One of my senior professors once told me, listen to the patient, they'll tell you everything you need to know. And the other side of that conversation is equally important, telling patients everything that they need to make healthcare decisions. So communication is at the heart of what's important about your new French hospital. The single patient rooms are create an unprecedented local setting. They're tools for safe, confidential, private, thorough, and honest communication amongst the whole team, which includes the patient, their loved ones, the physicians, nurses, and a wonderful caring staff that we have here at French that are too numerous to list. So of course, we've learned in this past year that single rooms have many other benefits. They could greatly reduce inadvertent transmission of contagious disease. They allow patients to rest and recuperate with minimum disturbance. And they give room for in-room testing and rehabilitation. So these advantages we must have in our future, and we're so happy to have them breaking ground today. As to the future, remember that the best time to plant a tree was 20 years ago. The second best time is today. So anyway, I'd like to introduce Bob, someone whose entire career has been planning people's financial future. Bob's a great civic and business leader, and he can speak to the community's benefit from our new French hospital. Bob?
Thank you, Ping. Yeah, you know, you don't actually have to work here at the hospital to recognize the importance that it plays in our community. And I'm on that other side. In our campaign, I refer to Ping as Dr. Inside, and I would be Mr. Outside. He said we sound like a couple running backs, but anyway, we had a lot of connections with a number of different people. And having been here for almost 35 years in the community, I've seen the history of French Hospital back to the dark days that Alan talked about, and to the resurgence that started roughly 20 years ago, and for which Alan is greatly responsible. Alan is greatly responsible for a lot of the comeback for the hospital, which is. I think Alan. It'd have to be said that Alan is greatly responsible, but it's been a terrific resurgence of the hospital, and it has become our hometown hospital, and we're all very proud of that resurgence. You know, my wife has volunteered here since we moved here almost 35 years ago. Of course, the volunteers were a casualty of COVID over the last year, and they couldn't come back, and now they are unbelievably excited. I was telling Julie about the prospect of being able to come back and serve with the passion that they all have for the hospital here. They're really, really looking forward to it. My mother, before she passed away about 10 years ago, was a somewhat frequent visitor and guest at the hospital, always getting wonderful care, and we're very glad that she is commemorated with a tile in the garden here at the hospital. My daughter, Stephanie, was diagnosed with a serious kidney disease when she was a freshman in high school almost 25 years ago. And thanks to the wonderful care of Dr. Kathy Long, who we love forever, here at the hospital and was at French, recovered fully. And I think it was that experience that led her, after she graduated with a degree in chemistry and went into biotech, to give up that career, go back and get a bachelor's in nursing. And she's a passionate ER nurse in San Diego now, and has found her calling. And a lot of it was that experience at French Hospital that propelled her into that. My son just had, I think, 3 visits with broken bones, so nothing really serious here. But for 3 years ago then, my cardiologist, to make it a little personal, said, Bob, your heart is great, but you've had this murmur for 60 years, and it's time we need to replace your aortic valve. Unfortunately, I qualified for a procedure called a TAVR, a transcatheter aortic valve replacement, and I had all sorts of people telling me, you better go to LA, you better go to San Francisco. They do it here, yeah, but they haven't done as many. And I said, I know the heart people at French Hospital are terrific, and I elected to have it done here. I was awake through the whole thing. It's an amazing procedure if you've never heard of it. And it worked out great. I was here one night, and only because my wife insisted that I stay one night. I think she just wanted one night without me before I came home. But it was a wonderful experience here at French Hospital. So I've seen the importance of this hospital not only to my immediate family, but to my friends, to all the people in my community. As an employer, somebody who built a business here, how important quality health care is to businesses, in terms of recruiting employees. We have a lot of folks who move here from other places, and one of the decisions factors, the criteria that comes in whenever they decide where they're going to go at retirement is the quality of the health care there. So it's extremely important across the board for our community to have the health care here that French Hospital can offer. And one of the reasons that they can offer all of this is because the generosity of donors like Bill and Cheryl and other people that have really made sizable contributions or small contributions. But those are the things that you're not going to find happen mostly in a corporate hospital that does not have the connection with the community that French Hospital has always had, and certainly under Alan's leadership has in spades over the last several years. It is our hometown hospital. It needs to provide the quality health care that we need here. And so when I was asked to co-chair this campaign with Dr. Sal, I said, yes, absolutely, I would be honored to do that, and we want to make sure that that happens. Last year, then, I got an opportunity. I was diagnosed with a cancer that needed major surgery, and once again, I had people telling me, go to LA, go to San Francisco. You don't want to do that here. But I knew Dr. Eddie and Dr. Howard Hayashi. I knew that they would do a great job. I knew that French Hospital would be a great place to recover. And so I elected to have my surgery here. Unfortunately, there were some complications, and I was a guest. I call it my extended French vacation for 52 days here at French Hospital last year. The opportunity, though, although that was not the outcome that I'd hoped for, it ended up great. And the opportunity I had was to witness firsthand the caring, the skills, the culture of caring and collaboration that exists here at French Hospital. We have wonderful people with wonderful skills. The nursing was terrific. The technicians were fantastic. One of the things that really got me is that, when you're recovering from surgery, you're supposed to get up and exercise and do something. So I would walk miles in the hallway, occasionally stopping at the 10 by 12 chapel, the converted closet chapel in the hallway down there. But all the time that I did that, I would run into people from the hospital, the employees of the hospital, and universally they would go, hey, way to go get them. The encouragement that you get here is part of the caring community, the collaboration and so on that you get at French Hospital, and it was terrific. I had a group of nurses who all gathered and gave me big applause when I left after 52 days. I'm not sure exactly what that meant. I'm going to assume that they were happy that I was getting home for my own benefit, not that they didn't have to deal with me anymore. But at any rate, I also got to hear the medical history and the consultations for the 15 to 20 roommates that I had over those 52 days. So talking about the private rooms would make a terrific improvement over that situation. But the care was wonderful. So we have first-rate people here at the hospital. We always have had. We have a first-rate exemplary culture here at the hospital. Even in the dark days, we had that. We had that with the people who really have a sense of caring and wanting to do their best and serve the patients that they serve. And what we need is to have facilities that match those levels of excellence. And as Alan mentioned, we are halfway there. We are $15 million raised of our $30 million goal, and we need to get all the way there. So anybody who's hearing my voice, I ask them to make sure that you are part of this effort. This is extremely important that we have this excellence of care all the way across with the people, the culture, and the facilities in our local community. So I urge you all to continue to press on to make sure that we reach our goal in the Beyond Health campaign. And I thank you for the opportunity to speak to you today.
Thank you, Dr. Sal and Bob. Thank you so much. Now, I get to introduce our wonderful chaplain, Flora Washburn, who's going to come up and take us through a little bit of a groundbreaking ritual. Flora.
Hi. I'd also like to recognize Tom Fenstermaker, who is the chaplain who's here every single day, because I'm not always here every day. I really am grateful for this opportunity. It's extremely meaningful to me. As a hospital chaplain, the chapel is a significant place. It says a lot about the community and about the people that you serve and just about the care that you give. And before I was hired, I visited French, and it was this little tiny room. Although it did have interfaith symbols and it had pamphlets, and it was a good place to come and be. But you could maybe have 4 to 6 people in this room at one time. So a new chapel, you know, even though it was moved, there just hasn't been the space at French to really have anything larger. So when Alan said that we were going to be doing a building expansion, my first thing was, will it include a chapel? And he said, of course, and told me the story that he had shared with the sisters back in 2004. So I'm very excited. And when I talked with Alan about the chapel, just exactly what he shared with you is what he shared with me about his heart and hope for what a chapel would be. That was incredibly important as well, to know that he had that vision for what this could represent. And then we met Bill and Cheryl Swanson. And the first thing that Bill asked was, what's your intent? What's your purpose? What's your hope? And Bill and Cheryl always wanted to know what we wanted from this chapel, what we wanted it to be, and how we were going to serve this community. I got, they have it. They've got it. Throughout this entire process, with all my heart, I thank you both. And I thank you for understanding exactly what we were trying to accomplish. And I'm so excited and so look forward to the day that we get to do a ceremony and walk in the chapel doors. The second thing is that there's just 3 things I want to share about this, what this means to me and the groundbreaking today. The first is that I see starting with the chapel as starting with the heart of French Hospital, because we represent holistic care. The Beyond Health campaign is all about the whole person and reaching out into the community, how we serve, as I understand it. So that whole person, holistic care involves body, mind, and spirit. Starting with the chapel allows us to say, this is who we are. It doesn't matter what your religious beliefs are. It just matters that you have a place that you can come to when you need to walk into a room and sit and be. That's important. The second thing I saw was in regards to the land. As many of you know, the Chumash Indians are the ancestors who have lived on this land for years and years and years. What was always important to them was the spiritual, the mind, and the body. They always started with the spiritual side of care and anything that they did, and they always started with prayer. So that was significant. And the third thing to me was that when I'm thinking about groundbreaking, I think about digging, I think about the soil, I think about planting, I think about harvesting, and I think about carrying on. When you till and you plant and you water, and you have the opportunity to perpetuate year after year after year something that grows and something that's better and something that expands in regards to what you've planted. And I see that in this Beyond Health campaign, starting with the chapel, of course, but with the entire campaign of who it represents for French Hospital. That history of those who've gone before us, that compassion, that desire to carry on the healing ministry that was started from our end for those who came before. And so when we're doing this groundbreaking, I see planting seeds of hope, planting seeds of anticipation and expectation. So I'm going to call up those who are going to participate in this groundbreaking, and then I will explain what we're going to do from there. Bill and Cheryl Swanson, would you come on up? Danica's going to hand you a shovel. Julie Springle, President, Southwest Division, Common Spirit Health. Alan Iftinik, President and CEO, French Hospital. Anita Robinson, Vice Chair, French Hospital Community Board. Eric Justison, Chair, French Hospital Foundation Board. Dr. Peng Sao, Co-Chair Beyond Health Campaign. And Bob Wacker, Co-Chair Beyond Health Campaign. Thank you all. Thank you for being up here. So we're doing this a little bit differently, in the sense of the planting of seeds of anticipation and hope. I'm going to call each name, and I'm also going to give them a seed or seeds that they will be planting as they dig into the ground. So they're going to be doing this one at a time. We're going to start with Bill and Cheryl. And Bill, as you dig, would you dig seeds of innovation? Cheryl, would you dig and plant seeds of hope? Julie, will you plant seeds of connectedness? Alan, will you offer seeds of compassion and caring? Anita, will you offer seeds of courage? Eric, will you offer seeds of strength and peace? Dr. Sal, would you offer seeds of healing and comfort? And Bob, will you offer seeds of prayer and vision? Now I ask each of you, what seeds of anticipation, expectation, and hope would you offer and would you plant for this chapel and for the expansion of French Hospital, for the community we serve, and for all that we care for? Please join me in a prayer. Together we bless this ground with seeds of anticipation that are in each of our hearts, with hope of a future that builds a healthier community, spiritually, emotionally, mentally, and physically. We give thanks to those who came before us with vision and purpose. We give thanks to the communities French serves. We give thanks to the leaders of our community. We give thanks for those who will come after as they continue the vision and expand it for greater purpose. Amen. Thank you. Alan?
Beautiful as always. Thank you, Flora. I want to thank all of our speakers for their wonderful words. You inspire me. Your passion, your compassion, your dedication, commitment to what's in the best interest of this community, overwhelming to me. Thank you all for being at a kind of a different groundbreaking, abbreviated. Usually when we have these things, there are hundreds of people in big tents, and we have lots of food and champagne, and we celebrate in a very different way. But I think in this times, in these days, this is just as meaningful as any groundbreaking we've done, probably more so in the history of French Hospital. So again, thank you very much. I've got a couple of gifts that I would like to give. Cheryl, this is for you. Thank you for your support, your compassion.
This is one I call Jackie Stewart, not Jackie Star. Most people call her. Sorry.
I'm always bailing Bill out, so I'm going to do that again. Bill asked me to correct a misstatement on his part. Our wonderful interior designer is Jackie Starr. He mispronounced her last name and was very sorry and apologetic and asked me to extend that to you. So this concludes our event, our ceremony today. Thank you for adhering to our COVID safety protocols. Thank you for being involved in what is a truly historic moment for us. And as Flora and the other speaker said, I can't think of any more appropriate way to kick off your New French Hospital for what it says to our community than by starting with our beautiful new chapel. Again, thank you to our donors. Thank you to all of you. God bless. Stay safe. Be well. Thank you.